New York City is a healthy city, and on average, our life expectancy actually exceeds that of the United States as a whole. But when we look by neighborhood, we see big differences that can be documented in numbers of ways. Along the number 6 train, you can see drops in life expectancy as you go from the Upper East Side to East Harlem to the Bronx of 5, 6, 7 years. The biggest gap is actually between Brownsville, that actually happens to be my first neighborhood in New York City when I moved to New York City as a little girl, and the financial district. That's an 11-year gap. That's big. That means that Brownsville has a life expectancy that's more on lines with Sri Lanka. And a developing country than the city as a whole. So one of my first activities was to establish the Center for Health Equity, which has as its goal both documenting with data the differences by neighborhood health and beginning action based mainly on the district public health offices that you heard I established as a deputy commissioner. And also working internally as an agency to bring the equity lens to all of the work that we do. We have created these things called community health profiles. We have 59 of these for every community district in the city. And the reason we did them by community district is that every community district answers to a community board. And with a community board, these are the smallest local levels of government. So all of you may find these data of interest because they may speak to neighborhoods that you cover, neighborhoods that are important parts of your audience. And of course, documenting data is a key role of the health department, but our additional role is action, changing those health profiles. And we've launched a program that's been in place for several years now at the health department. The first one was in 2004 called Take Care New York. And we are now in the process of finalizing Take Care New York 2020. This time we're doing it with a process of community consultation that is much more robust than anything we've had. We want to go out to communities and talk with them about their lived experience. So we show data, they tell us what they consider important. So that is a key part of our work.